Good afternoon, and welcome to the Senior Rep Line. May is Older Americans Month. This is a time to recognize older Americans' contributions, highlight aging trends, and commit to serving older adults. This Older Americans Month, we'd like to take a moment to look at a common and serious health risk for older adults and how you can keep yourself safe. We're talking about falls prevention. Falls can happen in an instant, causing injuries, disabilities, and loss of independence. A simple accident like tripping on a rug or slipping on a wet floor can change your life. The good news is that falls are preventable. Right now is a perfect time to take a look around your house and reevaluate potential hazards. I'd like to welcome our guest for today, Kris Wilson. Kris is an occupational therapist and home safety consultant. He is the owner of Modified Independence Evaluations. Thank you for joining us today, Kris, to talk about this really important topic, falls prevention. I'm sure we all know someone who has fallen in their senior years and in many cases had their lives changed because of the injuries. Kris, can you start off by first defining what a fall is and how someone can find out if they're at risk for a fall?
Yes, Dr. Jackson, and thank you for having me on the Senior Rap Line. Really appreciate this opportunity. So I like to define falling. That way we know what we're talking about. And the technical definition of a fall is an unintended descent to a lower level, meaning somebody can't control their body weight. So you've probably seen these folks. They go to sit down on the couch, and then they plop down on the couch because their legs can't hold them up. That is actually technically defined as a fall. And we combine it with risk, the word risk. Essentially, I like to explain to patients that when doctors are screening them for a fall risk, what the doctor's screening them for is the inability to control the descent to a lower level and the injury that could happen from that. So we just worry about whether people can control their body weight and stop their body weight from going to the floor.
So can you tell us about some of the factors that can make an older adult more likely to fall?
Well, I like to first say that we could take the word older out of that sentence because falls don't have any prejudice for age. Falls can occur to young people just as well. So the most common risk factors are actually diseases. So those would be things like Parkinson's, ALS, MS, neuropathy, diabetes, loss of vision. Those kind of risk factors are risk factors that we as humans carry around with us every day. Other risk factors are external risk factors like taking too many medications or medications that cause people to get dizzy or drowsy, like mood enhancers or muscle relaxers or pain pills or even blood pressure pills. A lot of times we see patients that have blood pressure medications, and when they stand up, they feel dizzy. So those risk factors are the things that we're actually looking for. But that doesn't mean that if you don't have those risk factors, that you're not at risk for a fall.
So all falls are preventable. So why do you think so many seniors are reluctant to come forward and discuss their concerns?
I think it's a matter of stigma. We have developed a society amongst our seniors where seniors feel ashamed because they have fallen. It's amazing. We don't shame seniors for having heart attacks or getting cancer or getting Parkinson's, but when somebody falls, they go to the hospital, the family worries about them, they go to the rehab, and it just feels like if I fall and I tell somebody about my fall, or if I'm afraid of falling and I tell somebody about it, then there's all these other things that are going to happen. All these strangers are going to come and talk to me. These people are going to come to my home and try to get me to do exercises and stuff like that. And I think that's why most of the time people are reluctant. And then you combine that with the risk that they may not be able to stay in their home anymore if they are honest with people that they're afraid they're going to fall. So that reluctance is really an internal thing that we carry around as humans, that we don't want to be vulnerable and share with somebody where we are in our aging process.
You know, something as simple as tripping on the corner of a rug or falling can trigger a number of other problems. Can you tell us about the cascade of problems that can follow a fall?
So after somebody falls, a lot of times they've got to go to the hospital. Well, nobody sits at the hospital by themselves, so that means your kids have to call out of work and come talk to the doctors. And, you know, the doctor never shows up when the family's there. The doctor shows up 15 minutes after the family leaves. So in order to combat that, the family stays with you at the hospital all day. The cost of a fall is not just the being at the hospital. The cost of the fall is what everybody else around you has to do to compensate for the injury that you sustained from the fall. Think about this. If you fall and break your leg and you already have problems with moving yourself around, now you've got to get into a wheelchair. And if the wheelchair doesn't fit through the door in the bathroom, then you can't take a shower. And then if you can't take a shower, you can't do your hygiene, so you're at risk for getting an infection. So all of these things are simple things that happen in line when somebody falls. And the best thing to do is just prevent the fall in the first place.
And I never thought of it like that, Kris. What can a senior or a caregiver listening to this program do to prevent falls in their home?
I get asked this question many, many times a day. And the simple answer is visibility. I think that's the number one thing that I see in homes. I just came out of a patient's home, and for some reason she's low vision because of glaucoma, and diabetes has robbed her of some of her vision. And when I'm walking around in her home, I mean, I'm a 49-year-old man, and when I'm walking around in her home today, I actually had to flip the lights on because I was like, boy, it's really dark in here. So now imagine her situation where she's low vision. It's even darker to her. So the best way to avoid an obstacle is to be able to see the obstacle. And the best way to see the obstacle is to make sure that you have plenty of overhead and automatic light. So we want lights that come on automatically when you go into the hallway to your bedroom. Or we want lights that come on automatically when you go to the bathroom.
Wow. Kris, you own your own local business, Modified Independence Evaluations. Can you tell us about what goes on into having a home assessment? You mentioned one thing about the lighting, but can you tell us other things that go on with the home assessment?
Yes, ma'am. Well, I like to discuss the elephant in the room, and the elephant in the room for me is always the rugs on the floor. I feel like my seniors have to hear multiple times that they need to get rid of their rugs. But the nice thing about it is when I'm doing a home safety assessment, I try to understand why is the rug there. A lot of times we have rugs in front of sinks or in front of doorways, but those rugs are there because it's a wet spot. So what we do is instead of having a rug there, we can say, hey, instead of wiping your feet and just leaving the rug by the door, let's wipe our feet and leave our shoes off beside the door and then have a pair of house shoes like Mr. Rogers, or the kitchen sink. If you have a rug at the kitchen sink, why is there a rug there? Well, maybe we spill some water out on the floor. They actually make materials that you can put on your floor to make your floor stickier so it's not slippery when it gets wet. That's the number one thing is, like, I try to find what people are doing because a lot of times people will try to remedy the problem themselves. So I like to understand what they've done as far as their concerns, and then I just add my special recommendations to it. And those special recommendations are people in the community that I know that you can trust to come to your home and help you to fix the problem. because I don't think it's fair that I can come and tell you that you have a problem with your home, and then I'll also come back and charge you money to fix it. So I try to make sure that there's no conflict of interest. I just come and do my assessment, and then I connect you with people in the community that you could trust.
So a reality for many older adults is making their budget stretch on a fixed income. How can an older adult pay for these services?
That's a wonderful question. We get asked that question all of the time. The first thing is getting a home safety assessment done. Get somebody like me in your home, because if it turns out you don't need all of those grab bars, you're going to save yourself a bunch of money. The going rate for one grab bar in Jacksonville is $300. So if you don't need that grab bar, we just saved you money. The other thing I tell people is if you're a veteran, please go to the VA. The VA has ways of helping veterans get equipment that they need. If you live in Clay or Duval counties, contact Aging Through and Elder Source, because they have resources to assist patients. The last thing that I tell people is a standard home, after hundreds of thousands of home safety assessments that I've done, a standard home for me costs about $693 to make it safe for the entire lifetime that a senior lives there. They don't have to do super expensive things to make their home safer. So we try to help them find cost-effective ways in order to make their home safe.
So in addition to the work that you do to help older adults, you're also a part of the Caregiver Coalition with Elder Source. Can you tell us a little bit about that?
Yes, ma'am. The Caregiver Coalition of Northeast Florida was created to support and be valuable resource for local caregivers. The coalition is a partnership of healthcare, aging, and senior services organizations that serve caregivers. It offers virtual and in-person events, a quarterly newsletter, as well as in-depth resource card that helps seniors get connected to resources in the community.
And are there many resources in the community?
Ma'am, if you could be in the room when we get these meetings together, you would be surprised. It amazes me every time I meet a senior and they're like, oh, there's nobody that does that. And I want to say, no, I know 5 people that do that exact thing. And I know I can introduce you to all of them and you can trust them. It's amazing. There are more resources, and I surprise myself every day when I find out about new things. We just found out about a program for ramps in Duval County yesterday.
So how can our listeners learn more about you and the Caregiver Coalition?
Well, first, talking about myself, my name is Kris Wilson. It's Kris with a K, so K-R-I-S, Wilson. You can look me up that way. I have a lot of different resources online on the internet. The name of my company is Modified Independence Evaluations. I am on Facebook, Instagram, LinkedIn, YouTube, and you can reach me there. I do have a funny way of remembering my website. My website is actually www.callbeforemomfalls.com.
Call before mom falls.
Call before mom falls, absolutely. Okay. And then my phone number is 904-710-8571. And one more time for the people grabbing a pen, my phone number is 904-710-8571. If you call me, we'll try to figure out if we can get you screened so we can bill your insurance for the assessment, and we'll connect with your doctor and help you with all of those things. And then you can learn more about the Caregiver Coalition by heading over to www.caregivercoalition.org or searching Caregiver Coalition of Northeast Florida on Facebook.
Well, thank you so much, Kris, for joining us on the Senior Rap Line. Kris Wilson from Modified Independence Evaluation. We remind our listening audience to call for help before you need it. And before you do anything, always remember to pray. God bless you, and thank you for sharing this wealth of very wonderful and needy information with our community, Kris. And you have a great day and a great weekend.
You too, ma'am. Thank you very much. Y'all have a great day. Be safe.
Be informed, inspired, enlightened.
24/7.
Through the word and music. The Victory Station.
AM 1360.
And FM 94.7.